Health plans more complicated than a quadratic equation? Hi, I'm Kevin Knaus with InsureMeKevin.com, and health plans are complicated, a lot of moving parts. The one thing I did learn in algebra was that you sometimes need to break down the problem into different parts and focus on individual parts before you can make a final solution. So that's what I'm going to do, is I'm going to try and take these health plans and break them down into different parts and describe them so you can see how they all kind of interconnect, because looking at one page it's kind of overwhelming. What's happening here? So the nice thing about Covered California is they have a standard benefit design plan that all of the insurance companies must use in the individual and family market. So a Silver 70 will have the same covered benefits and essentially the member cost sharing structure as a Silver 70 PPO, HMO, through Covered California, off exchange. They're all going to be the same. The rates may change, but the structure is going to be the same. There are some non-standard benefit design plans off exchange, but they are going to have the same structure and all the same covered benefits. Some of the cost sharing will be a little bit different, but they're going to work pretty much just like the Covered California and the standard benefit design plans. So the first health plan element that I think is underrated and not talked about enough is this annual maximum out-of-pocket amount. It translates into asset protection, your maximum liability for healthcare costs. Once you hit the annual maximum out-of-pocket amount through a combination of healthcare services and prescription medication costs, the health plan pays for everything for the rest of the year when you're using your in-network providers. So on a bronze plan for 2023, once an individual has accumulated $8,200 in medical and pharmacy costs, the health plan's paying everything for the rest of the year, 100%. And you can see some of the others have gone up. Silver has gone up for 2023 to $8,750. Gold is at $8,550 for an individual. And the way the family maximum out-of-pocket works is once two people have met their maximum out-of-pocket, that spills over to everyone else in the family so they don't have to meet it. So that can be a big savings. But oh my goodness gracious, let's hope you never have two people in the family meet the maximum out-of-pocket. That would be fairly catastrophic in terms of something going on in the family. But that maximum out-of-pocket is very important. And then, like I said, it's asset protection. You know that you are not going to have to shoulder any more on a silver plan than $8,750 for an individual. And so, yeah, that's a lot of money. But that means you won't have to sell your home and you won't have to declare bankruptcy. So that's very, very important. The next is the deductible. And many people think that they have to meet a deductible before anything is covered. And that only applies in the bronze, high deductible health plans and the minimum coverage plans. With the bronze high deductible health plans, the deductible is $7,000, but that also happens to be the maximum out of pocket. So once you meet your deductible, you've met your maximum out of pocket and everything is covered. But there's no member cost sharing for any particular services under the high deductible health plans. Under the bronze, you do get a few office visits and some labs, but you do need to meet a medical deductible of $6,300. Then you go into coinsurance. So the next dollar over that $6,300, you pay 40 cents. The health plan pays 60 cents. Then when all of those costs, the deductible, any copayments, prescription drugs, when it reaches $8,200, the health plan pays for everything for the rest of the year with in-network providers. Now, the silver, that's very interesting. The silver health plan deductible only applies if you are inpatient hospitalization or skilled nursing facility. Okay, that's very important. So most people won't even dip into a medical deductible unless they're hospitalized. They'll go through lots of routine services that are not subject to a deductible, and so that never comes into play for them. So you can, once you get a silver plan, boom, straight into coinsurance and copayments. And the same thing, the gold and the platinum, they don't have any medical or pharmacy deductible. You can see the bronze plan, there's really no pharmacy benefits there, and that deductible doesn't, it only means it caps some of the higher drug costs. For the silver plan, silver 70, it's an $85, which is fairly low. Once you spin that, then you go into the co-payment structure. And the drugs. Drugs are a whole separate animal, and actually a big driver of the health insurance rates. You'll see that there's these different tiers, and they assign different drugs to different tiers. Generics being tier 1, the least expensive. But as you go up for brand name drugs or even specialty drugs, you have to pay more. They're in a higher tier, which means you have to pay more of the cost. And one thing that isn't necessarily evident is that some carriers will have the same drug in different tiers. So you may be looking at a health plan that has your preferred drug in tier 2, and then there's another health plan that you like, but that same drug might be tier 3. So it's going to cost you $30 more. Tier 2 is $60 per month once you've met the deductible, and the tier 3 is $90. So that adds up. However, I will say, anyone taking prescription medications really needs to look at a silver plan or higher, because the cost savings with the lower copayment amounts can really save a lot of money, more than the differential between the lower cost bronze plan and the silver. Another thing I will mention is that you always need to run your drugs through the insurance plan. I know sometimes with the pharmacy discount programs, you may be able to get the drug a little bit cheaper. However, if it is not run through the insurance plan, then it will not accumulate towards meeting your maximum out of pocket. And that may not make any difference, but there may be some years where you're right there, and having those drugs, an extra couple $100, might push you over the maximum out of pocket, and then everything's covered for the rest of the year. So it's important to run your drugs through the health plan. Now, a big benefit are these tier 4 caps on the plans, silver through platinum. So most of the time in a silver plan, you're going to be paying 20% coinsurance. So if the drug cost $1,000 for a 30-day supply, 20%, you'd be paying $200. If the drug costs $2,000, 20%, that would be $400. You wouldn't pay that. It's capped at $250 for a 30-day supply. And that's a big benefit, especially when someone comes up with a disease and it's like, whoa, and you're prescribed something that is very expensive and you didn't have any knowledge of what was coming. And that can really, really help, the script on the cap on the prescriptions. The final big element, and for most people, the heart of a health plan, are the covered routine services. And these are really important for most people, especially if you're managing a particular health challenge. Now, for some people, the bronze plan, you get these 3 office visits, primary care, urgent, specialist visit. And then once you've had 3 visits of any combination, then you go into the full negotiated rate for office visits and those services. Labs, $40, unlimited throughout the year. Of course, all of the plans have no cost preventive services. So it doesn't make a difference what plan you have. Certain preventive office visits and services will be 0 cost. But for everything else, diagnostic and therapeutic, there's usually going to be a cost involved. So for some people who don't usually go to the see a doctor, take no drugs, bronze plan might just be fine. And we know that you have a maximum out of pocket of $8,200. For people who are managing a chronic illness, have a particular challenge that they need to work through, a silver plan or better, you know that you're going to have these set co-payments for office visits, an emergency room, and lab tests, x-rays, and imaging. And that's very comforting to know that many of these services you're just going to have a set co-payment with. And obviously as you go up towards gold and platinum, those set co-payments go down, but of course your premiums also increase. Now, one thing that Covered California doesn't really talk about, and neither do the other health plans, is this coinsurance. Now, like I mentioned on the silver plans, the deductible only applies if you're hospitalized or in a skilled nursing facility. Coinsurance for outpatient procedures, you do not have to meet the deductible. So if you go in for an outpatient procedure and maybe it's $1,500, you're going to pay 20% of that. Okay? What has changed for 2023 is that they've split up those coinsurance percentages. So it used to be that inpatient hospitalization was 20% after you met the medical deductible. On the silver plans, they've pumped it up to 30%, and the same with the gold. So, of course, the gold doesn't have a medical hospital deductible, but it's going to cost you more if you're hospitalized and you don't meet that maximum out of pocket. But yeah, that's one way of looking at it, is that you're paying more in that higher coinsurance, so you might hit that maximum out of pocket sooner. The HMO plans can be a little bit different, so you really need to look at those. There's, one carrier that has a gold copay, so that the hospital stays are just a flat fee per day, but they also have a coinsurance, a gold coinsurance, where it's subject to a coinsurance percentage. That plan obviously is less in price because the member, you, are shouldering more of the costs. So you need to look at the health plan designs on the HMO side because they can be a little bit different. But in general, you should be looking at the summary of benefits and the evidence of coverage. Now, I will say that this is on the coinsurance can get a little bit confusing because sometimes you get hit with coinsurance and you thought, well, I thought that was a set copay. Specifically, I've come across a situation where someone goes in for like a CT scan, imaging, and they think, oh, I've got the silver plan, it's going to be $325. And then they get hit with a coinsurance for a procedure. Well, the imaging for the machine was $325. But they needed to put in a dye to increase the contrast for the CT scan. Injecting the dye is an outpatient procedure and subject to coinsurance. So you might get an additional cost, and unfortunately doctors and hospitals aren't very good at explaining that. Sometimes the health plans explain it, sometimes they don't. But that's where some of this stuff comes in, and it can be kind of nagging, like, why am I getting billed for this? But those are kind of the elements I see in the health plan. We have our maximum out of pocket, the deductibles, the drugs, which are weird, and then the heart of health plans, which are your routine services. So if you have any questions that I might be able to clarify, you may leave them down below or comments. You can visit my contact page at insuremekevin.com, reach out to me via email, and I'll do my best to explain those or try and get answers for you. Otherwise, for insuremekevin.com, I am Kevin Knaus.